Hello, viewers. Welcome to Women Health Tips with Sarah. The topic for today is cervical cancer and screening. Making your health a priority as a woman. The purpose of this presentation is to create an awareness for women and how to take charge of their health. Cervical cancer, it's the abnormal growth of cells around the cervix. Normally, the cervix is covered by a thin layer of tissue made of cells. The cells grow, divide, and replace as needed. But in cancer cells, they divide rapidly and into a deeper layer of cells and possible spread to other cells and form a mass of tissue, which is referred to as tumor. Here I have a picture of woman reproductive organ. Here is the fallopian tube. Here is the ovary. Here is the uterus. And here is the cervix, which we are talking about today. Cervix is like a neck of the womb. It is where it's open up during labor and the baby passed through it and through the vaginal area, and the woman had the baby. So later on my presentation, we are going to talk about labor and delivery so that the women that are pregnant for the first time will be able to know and have an idea of what labor and delivery is all about. So, and also over here we have another fallopian tubes. We have two fallopian tubes. We have two ovaries. This is endometrium and this is the myometrium. These are the muscles of the womb. Okay. This is also cancer, cervical changes when there is cancer. This is the cervix and this is vagina. This is a normal cells in the cervix, and this is not too bad cells. I should say normal, stage 1, stage 2, stage 3, according to the picture. This is what happened when, this is how the cells in the cervix looks like when a woman have a cancer. What are the causes of cervical cancer? The causes of cervical cancer is human papillomavirus infection. This infection is actually preventable. This infection has vaccination. This infection can be taken care of while allowing it to cause cancer for us. There is a high risk type of HPV which can spread to the anus. So this infection can spread to the anus, the cancer, the vulva, vagina, and penis for men. It doesn't only affect women, it also affects men too. HPV in women, it causes cancer of the cervix, the vagina, the vulva. In men, it causes cancer of the penis, and I'll tell you others as we go on. They can also cause cancer of the neck, some other linked to genital warts. Gene mutation, that's the defects of gene, turn off tumor suppressing cells. So when there is a defect in the gene, it turn off the cancer suppressing cells, and so the cancer cells grow more than. So worldwide, I'm giving you analysis now. Worldwide analysis of cervical cancer from 185 countries from Global Cancer Observatory in 2018 database. 570,000 cases of cervical cancer. Hear me well. 570,000 cases of cervical cancer, and also 311,000 dead from cervical cancer occur in 2028 in a study. So what are the signs and symptoms? Any of the following could be signs and symptoms of cervical cancer: blood spots or light bleeding, between or following period. So let's assume a woman had a period for 3 days, for 5 days, depending on your cycle. And after 5 days, your period was over, and come maybe 10 days, you're still spotting. It is always good to see your doctor. It might not be cancer, it might be something else. It might be some women do get pregnant and in between the bleed and all that. It's okay, but it's good to follow up with your doctor. If this symptoms persist, you got to see your doctor. Menstrual bleeding that is longer and heavier than usual. In this also, women that have fibroid, they do have very heavy bleeding. So if you have heavy bleeding and longer than usual also, you need to see your doctor. Do not diagnose yourself based on this information. These are just combination of things that might happen if you have cervical cancer. The diagnosis is when the doctor performs tests on you. Increased vaginal discharge. Increased vaginal discharge. Remember, women always have a normal vaginal, non-smelling discharge. But when this discharges increases in the amount, and frequently you wear your undies and you change, or up to the point of you having to wear just a pant liner to protect your underwear, this is a time to see your doctor. And also, infection, regular infection, can also cause discharge. So you want to rule out if you are just having infection or if it is cancer. You're not diagnosing yourself. You're just knowing these things so you can report to your doctor. If even when the doctor will examine you, the doctor is not just gonna jump and say, "Oh, you have cancer." No, it doesn't work that way. The doctor is gonna do all the tests for you to rule out if you're having infection, if you're having fibroid, if you're having hormonal imbalances before the doctor. And then when all those tests are being done and there's no sign of any other thing affecting you, then the next step is to see, are you having, is it cancer of the cervix? So bleeding after intercourse or pelvic examination is another symptoms that individual may have. Pain during sexual intercourse, severe pain. I know some women do have pain when they have sexual intercourse, but not severe, depending on your partner and what is going on. But if it persists all the time, depriving you of that relationship, you need to see your doctor. Bleeding after menopause. Women that have had their menopause for like 3 years and in between they start having their period, it does not mean you have cancer. You need to go and see your doctor and have a test done. Unexplained persistent pelvic and back pain can is part of the symptoms. As I said, always see your healthcare provider, preferably your gynecologist. Incidence of cervical cancer. Cervical cancer is the number four most common cancer in women after breast cancer. The rate of cervical cancer is highest in Eastern Africa and lowest in Western Asia. Cervical cancer is the second most common cancer in women in Southeast Asia. Again, I repeat, second most common cancer in women in the Southeast Asia region. Are major causes of cancer death among women of low and middle income countries. I want to talk about this for a little while. Women causes of death among women of low and middle income countries. Why is it that way? Because they have not been screened, because they have not been diagnosed on time. So women out there in developing country, please do yourself a favor. Save money. Take care of your health. We save money to buy clothes for wedding. We save money to do a lot of things, but those things that we do goes on this body. And if this body is not healthy enough, the thing we spend money for will not be necessary for this body, because this mind is going to be thinking of what is going on in the body. So please take care of your health. Um, how do we prevent this infection or this bacteria from happening? The virus, sorry. Getting HPV vaccine is number one thing that we can do to prevent the virus from occurring. What are the risk factors for cervical cancer? Risk factor simply means people that are commonly what can make people develop problems. It's like people that that have malaria, they must have mosquito bite before they have malaria. So why do people have cancer? People that have multiple sexual partner. So please think twice before you make a choice. This is your choice. It's not mine, but I'm here to give you information about what may or can happen to you when this behavior is not minimized. Having a partner with history of multiple sexual partner, how does this affect you? You may ask. That is that person past? Yes. Before you accept being his or her friend, you talk, you date. That's why dating is very important. And you get to know the individual. If they talk about having or in their past history, they shouldn't lie, they should be honest. You go and test out to make sure everything is okay. Early age of sexual activities below 18. Young people out there, this stuff is not running away from you. And it's better to wait at the right age. Now you may ask, did you wait? I didn't know better either. But now I know better, I can educate somebody else. Probably I was not educated enough or I was not informed at the time. But I'm informed now. I know, I read about it, I have seen it. I have taken care of patients with this problem. So I am here to let you know, to encourage you. They say knowledge is power. And if you want to experience it, remember, some people might do the same thing. Some people go without having any complication, and some people might not have that luck to not have complication. So it's better to learn or hear from people like us that bring this information to you. History of abnormal cells. These are risk factors. Abnormal cells. A family history. If you have a family that have cancer, please do check yourself out. Chlamydia is another infection. People that have history of chlamydia infection, they are predisposed to having cervical cancer. People with immune system problem, if you know your immune system is low and you're having issues with your immune system, please be careful. Children whose mother took some medication. Women, I have to encourage you, please, when you know that you're pregnant, to avoid taking some medications that may affect your unborn child. Remember, that child is innocent. You have no right to take his or her health away from them because of your behavior. So please be careful of what you do when you're pregnant and even before you're pregnant, because sometimes when you do take some medication and you're having a relationship with people and then you get pregnant, it's 50-50 chances. Smoking is another thing that bother women health. So please, if you're smoking, smoking is a choice. It was a choice that individual made, but that choice help to give you extra side effects of health problem here and there. So it's advisable, please, the decision that you make to smoke, I believe you can do it. You can make a decision to stop smoking so you could prevent other incidents from happening. How to prevent cervical cancer? Vaccine is given at the age of 11 to 12 before individual becomes sexually active to reduce the risk of getting HPV virus, the virus that contributes to cervical cancer. Boys need to receive the vaccine too. It's prevent. You may ask, we are talking about cervical cancer. How does boys come in here? Boys also have, as I mentioned earlier, they have a cancer of the penis. They can have cancer of the anus. They can have cancer of the mouth. It can, of course, the boys can have cancer of the throat, and so it's better for them to receive it also. If you have never taken the vaccine, please talk to your healthcare provider. The vaccine is appropriate through age 45. So if you are from 9 years old up to 45 and you have never received HPV vaccine, please see your healthcare provider. It's never too late to do that. So when can I get? I just say it 11 to 12, and it could be given at age 9 too. Second dosage is given 6 months after the first dosage, between 6 and 12 months. The information that I'm giving you, it's a proof, it's a fact. I got this information from CDC, and there are so many means that people get information. CDC website is not everybody that might have an idea that such website is available for health information. So I decided to provide this video and make it available for other people that may watch my video, and through this means they are able to know about their health. Screening. Incubation for adolescent is a good idea. It is not necessary for tests. Inoculation, is good for adolescent to take the vaccine. You cannot test individual if they have the test at that age. HPV screening for women from age 30 and older is recommended. So HPV screening, meaning the test, is done from age 30 and older, but pap tests, these are different tests. We have HPV screening tests, we have pap tests at age 21 upward. This test is being done, pap test, to see if a woman have cancer. From 21 upward to 65, pap test is done. Pap test is not, I repeat, pap test is not done for any woman under the age of 21. So from 20 downward, please, you're not authorized. If your doctor offer you to pap test when you are not up to the age of 21, please do not do it, except there is any reason, maybe cancer runs in your family like crazy. Maybe that would be a reason to do it, but if not, don't do it until you turn 21. Pap test should be done every 3 years, remember? Every 3 years. Don't forget, this has also happened to me in the past. It's not because we are healthcare workers, we know everything or we remember everything. I have done some tests that I'm not supposed to do. I don't have history of cancer in my family. I've never heard about it. It was recently as I studied about that particular examination, and I got to know, why was this doctor having me do this test every year when I'm not at risk? And then so when I visited the doctor this year, he gladly ordered the test for me. I told him no. I read about it. Actually, for the past 5 years, you've been ordering the test for me. I'm not supposed to do it. I don't think I remember telling you I have a history of cancer in my family. And according to CDC and according to US preventive measures, I'm not supposed to. So, and then that was how I saved myself. So I believe that can also apply to some of you. Combination of pap test and HPV test should be done every 5 years. So these are the test screening to see whether individual have. If you don't have it, it's okay. So you just follow up every 5 years, depending on which of the tests you are doing. The U.S. Preventive Services Task Force, this is another website apart from the Center for Disease Control and Prevention that you can go and find a lot of information there. Vital information is available on this site. Look up for yourself to gain understanding. Remember, the information does not make you a doctor. Rather, it's informative. It equips you. Information is power. Consult with your physician or nurse practitioner for proper management. When you understand the concept, you will make a good choice for yourself. Thank you for watching. Please subscribe to my channel, and I want to thank those of you that have subscribed to my channel also. And I need all of you to be my partner. I'm not just here to be seen or to be noticed. I'm here to provide information. My target is to make sure that this information reach to a lot of people in the rural area. Please, as you go on vacation, don't just go on vacation in your hometown. You eat and rejoice and come back. Do something different that you've never done before. Gather your women in a circle, put a TV on, put this information on. Most of them must not have heard about this information before in their life, and they will be able to appreciate you and thank God for what you have shared for them. So thank you so much and remain blessed. See you next time in my next presentation.